Hey folks, Dr. Joe Esposito here. Glad you can be with us today. Really good show today. We're going to answer a question that everybody's been asking me. How do I know if I have COVID? Is it cold versus flu versus COVID? Now, again, the tests are there and the tests are controversial. Some people say they work. If you run the tests enough times, everyone tests positive from what I understand. The way they do certain tests, they're looking for viruses and they replicate the viruses. I think it's over 30 times. Everyone I understand tests positive. I don't know if that's true. It's what I've been reading in the literature though. So there's a lot of controversy of what works, what doesn't work, what if you're positive, what if you're exposed and you get tested and you're negative and then 14 days later you're positive. And so it really is a mess out there. But what we're going to talk about today is cold symptoms versus flu symptoms versus COVID symptoms. And then we're going to talk about the research. What research is showing on things you can do to reduce or eliminate your risk, not eliminate, but reduce your risk dramatically of getting sick of anything, cold, flu, or COVID. You're going to be surprised how inexpensive and easy it is to reduce your risk. And so we're going to talk about that today too. And then if we have time today, I don't know if we're going to have time. We've got a lot to cover here. I want to talk about testosterone, which again is a little going in a different direction. But I want to talk about testosterone, signs and symptoms of testosterone deficiency, and what you need to do to boost the testosterone. And it's really, really neat stuff because it's not just about sex. It's about muscle function. It's about healing. It's a lot of things that go on when it comes to testosterone. So we're going to talk about that. So let's cover this, cold versus flu versus COVID. COVID, the big thing that you're going to see with COVID is you many times lose your sense of taste and smell. Those are the two symptoms that, from what I can hear, from the research I'm reading, the people I've spoke to that have it, those are the two things that really get you. And then you're just wiped out. You're exhausted if it goes into a later stage. Very good friends of mine, one friend of mine, she had it, two of her kids got it, and she said, I didn't even know I had it. I had a little bit of loss of taste and smell. The third day it came back, I was better. Some guy I worked with at the radio station, he had it, didn't know he had it. Came back and tested. He had the antibodies. He said a little scratchy throat one day, a little headache for 2 days, then it was gone. So everybody's different, but there are certain things that I'm finding with people that have very mild symptoms or no symptoms compared to people that are just wiped out. And we're going to talk about that today. Again, COVID in exposure, incubation time could be 1 to 14 days. Flu, about 1 to 4 days. So there's a big difference there. Now, again, how do you know if COVID could be 4 days too? So again, it gets a little confusing there. But when you have a cold, symptoms like a stuffy nose or sneezing start out slowly and gradually get worse. With a flu, it hits you. If you ever had the flu, and I've had it before years ago, all of a sudden you just start going, man, this hit me like a ton of bricks. That's how the flu hits. So one way you can tell is kind of the way the symptoms hit. COVID can be different. Okay, with COVID, some people I talked to, in fact, just before I went on the air, I was talking to somebody who had it, and it was headaches, and then by the third day, they're just exhausted, they couldn't move. So COVID is weird because it's not following a lot of patterns, so that's a little tricky. Chills, when you shiver, your body temperature changes. Chills aren't typically a sign of a cold. It's a sign of an early infection. The flu is an infection with a high fever. So if you start getting the chills, that's usually the flu. If you don't have the chills, it's probably the cold. If you have a fever, it's rarely caused by a cold. Flu, bronchitis, pneumonia, COVID, of course, that's when you start to see fevers come in. So we've all had colds, and many people get several colds a year. That's a sign that the immune system is not working properly. And so we're going to talk about the immune system in a little bit, but let's go through these signs and symptoms first. Body aches, usually a flu. Certainly with the body aches, COVID can be a player there. I've spoken to people that have had severe cases of COVID, and they're just writhing in pain sometimes. There's nothing comfortable for them. Wheezing, if you wheeze, it's usually a sign of an infection like pneumonia or bronchitis, especially if it happens when you lay down. Wheezing can be a sign of anaphylaxis, which is a severe allergic reaction, but that really doesn't, people are still going to have allergic reactions. And that's the thing. I was out to dinner the other night with my buddy Tim, and I hadn't seen him in a couple of weeks, and he said, yeah, a couple of weeks ago, he said, I worked out real hard. Next day, he had a little scratchy throat, had a little runny nose. He said, uh-oh, what is it? And within a couple hours, it went away. So now what's happening is if somebody coughs, if somebody sneezes, if somebody has a scratchy throat, right away, we think instantly it's got to be COVID. And the thing with COVID, I was talking to one of my doctors today, is that the overall death, if we take all the people that die, and we compare it to years past till now, in the same time period, the death rate, I only saw one study that said the death rate has gone up. Overall, death from any cause. Every other study I read said the death rate has stayed the same. So COVID could be the thing that kills you, but usually there's what's called a comorbidity. Comorbidity, diabetes, heart disease, obesity, cancer, something that's already compromised the immune system. And then it gets worse. With COVID, the viruses seem to set up shop in fat cells. And one of the reasons that the morbidly obese or even obese people have more impact is that the viruses like fat cells. They like to live there and replicate. So again, there's all new research out. It's changing a lot. I understand it's confusing, but I'm going to give you the research on one thing, one supplement specifically, that has reduced the risk of COVID dramatically. I'm going to talk about that. And in fact, in England, they're even distributing it now. They're distributing a supplement in England to people that are high risk. I'm going to talk about that in a little bit. Cough with mucus, usually a cold. Fatigue, usually the flu. I mean, we've all had colds and gone to work and functioned. When you get the flu, you just can't move. You're just wiped out. Sore throat, usually a cold, sometimes the flu, sometimes with COVID as well. Headaches, it's a sign of COVID, but you can get headaches from other things too. Headaches can be caused by dehydration. We did a whole show on headaches. It's on the website, drjoe.com. It could be caused by artificial sweetener. I cannot tell you how many patients come to my offices, and I've been doing this for 37 years now, come to our offices and say, Dr. Joe, I have a headache. And we might give them the best chiropractic care in the world, and I consider my doctor some of the best in the world, if not the best in the world. And that's my opinion. And they still have headaches. Then we do a nutritional workup on them, and they're drinking diet soda. Number one side effect of aspartame is headaches. Now, aspartame is one of the sweeteners used in artificial sweetener, in anything artificial. But aspartame, number one side effect is headaches. I get them off the artificial sweetener, a couple of days they go through withdrawal, headaches are gone. So sometimes it's physical, and most back pain is physical. If you have neck pain, back pain, shoulder pain, headaches, chances are it's a pinched nerve, and chiropractic is the most effective, least expensive treatment for this. The studies are very clear on that. Headaches can be caused by dehydration, could be caused by monosodium glutamate. I know if I eat Thai food with fish sauce in it, I'm vegan, I tell them no fish sauce, sometimes they put it in anyway, blazing headache. So it could be monosodium glutamate, it could be artificial sweeteners, could be dehydration, could be a pinched nerve, could be COVID. So just because you have a headache doesn't mean you have COVID. Tightness in the chest, many times that's a respiratory infection, and of course that's what COVID does, it causes lung issues. Eye, face, and ear pressure could mean you have a sinus infection. And so many times you have to start considering, why do I have a sinus infection? Well, the number one reason people have sinus issues is because of food allergic reactions to dairy. The number two reason is wheat. So whenever I have somebody with sinus problems, regardless of whether it's cold, flu, or COVID season, I'll say, listen, you got to give up all your wheat and all your dairy. Had a lady come in yesterday, and she was overweight, back pain, shooting pain down her legs, and autoimmune disease. And I said, psoriatic arthritis. I said, you got to cut out the wheat and the dairy. And she just looked at me, and she did not want to do that. I can tell by the look in her face. And I said, well, it really depends how motivated you are to get well. I said, do what I say. Give it a shot. Do it for 2 weeks. If I'm wrong, I'm wrong. Go back to your wheat and your dairy. I've had that conversation countless times in the past. And when I can get people off wheat and dairy, inevitably, they feel better. And I always give them the challenge. If you don't feel better, that's perfectly fine. Go back to your old lifestyle. But give me a shot. And if I'm wrong, I'm wrong. I'm never wrong. And when it comes to that. And they say, great, they do it. They say, Dr. Joe, it's amazing. And then I cheated. Everyone says that. I cheated, Dr. Joe. I had a piece of pizza. It was Christmas. It was Thanksgiving. It was a party. I had a piece of cake. I felt awful. Excellent. Sometimes we have to learn by our mistakes. And so if you do feel awful, that's fine. You realized I was right. Then go back to where you were. Symptoms that won't go away. Flu symptoms may be bad, but they're usually gone in a few days. Colds can last up to 10 days. Pneumonia, of course, can be a month or two. And with COVID, everybody's different. We don't know. And that's why this testing is so popular right now. Everyone's wanting to get tested for these COVID, and if it's negative or positive. But again, we don't know if it's negative or positive because you might be negative today, but you really are positive. You just haven't incubated long enough. It depends how the test is done. So I want to talk about things that you can do to protect yourself and keep your immune system strong. I'm going to start by saying this is not a cure for any disease. Every show we do, every webpage has a disclaimer on it. I'm not here to tell you I have a cure for something. I am telling you what the research shows. 80% of COVID patients are vitamin D deficient. Now, to play devil's advocate, they might be deficient in other things too. But I'm going to show you what happens when you change your vitamin D level and what happens to symptomatology and the risk of getting an infection. So vitamin D deficiency has emerged as a primary risk factor in severe COVID-19 infection and death. Higher vitamin D levels have even been shown to lower your risk of testing positive for the virus in the first place. Once again, this is not a cure. I'm saying try this, see what happens. Vitamin D is the least expensive insurance policy you'll ever buy. It's so cheap to buy vitamin D3, not vitamin D2, vitamin D3. Vitamin D3 is the form I want you to take. Vitamin D2 has to be converted into vitamin D3. And depending how healthy your body is, ironically, will depend how well you convert the vitamin D, along with other factors. So just take the form that your body needs, vitamin D3. Vitamin D2 many times is a prescription. Vitamin D3 you can get over the counter. So I'm a fan of vitamin D3. That's the one I take. If we can get the word out on vitamin D, it could have a significant impact on hospitalization and death rates. So if you have a loved one in a nursing home, I want you to talk to your medical management about vitamin D testing and supplementation, because it can make a big difference in the general health of the residents, as vitamin D is something that can strengthen the immune system in a matter of a few weeks and has very few side effects. Now, can you overdose on vitamin D? Yes, you can. You got to take a lot. What I do is I take 5,000 international units a day. Now, on our website, drjoe.com, we have our own version of vitamin D. It's Dr. Joe's vitamin D3 with vitamin K2. Because if you take the D3 without the K2, you're not going to get all the benefits either. There are other brands of vitamin D3 out there. I like mine because I know it. I trust it. It's 5 drops of vitamin D3 a day. That's all it is. I take it. It doesn't have to be exactly 5 drops, 6 drops, 8 drops. I take a dropper full, about 2/3 of a dropper full, and I squirt it in my mouth. Amazing. And there was a Spanish study. It was published October 27th, 2020, so very recently. In the Journal of Clinical Endocrinology, 82.2% of COVID patients tested were found to be deficient in vitamin D. Now, studies have shown patients with higher levels tend to have milder diseases. In fact, one study found your risk of developing a severe case or dying of COVID-19, heavy statement, virtually disappears once your vitamin D level gets above 30 nanograms per milliliter. Wait a minute. We have something now, studies have shown, that can reduce your risk of COVID. Nobody's talking about it. Now, England, we talked about this earlier, England is actually distributing vitamin D to high-risk people. The government is distributing it because they realize that the studies are coming out now how good this is. Now, it's not the end-all, be-all. If you want to wear masks, if you want to social distance, if you want to get a vaccine, that's your call. I support that. But this is the one thing that everybody has control over. I may not have control over the fact that I'm in a room with somebody and they're infectious and they don't have any symptoms yet and they're spreading the disease. I may not have control over that. I do have control over my vitamin D levels. Darker skinned people, increased age, pre-existing chronic conditions, and vitamin D deficiency are all features of severe vitamin D disease, of COVID disease. Now, could somebody who does all these things still get COVID? Yes, they can. But again, we're talking about mitigating the risk factors. Vitamin D can reduce your risk of COVID-19 and other respiratory infections via several mechanisms. So it's not just one way of doing it. It reduces the survival and replication of the virus. It reduces inflammation and cytokine production. What happens is a lot of people, last study I read was like 50% of people that succumb to COVID, they have what's called a cytokine storm. If you've never heard this word, your body produces cytokines, which are they're white blood cells, let's say, and they're warriors. They're in there attacking. And what happens is if the virus becomes overwhelming, the body sends out another wave of these cytokines, and they start attacking the viruses, but they also start attacking your own lungs. And that's called a cytokine storm. And vitamin D can help reduce the inflammation and thus reduce some of that cytokine storm activity. So many times it's not the virus that gets you, it's your own body that gets you. But why is your immune system going so crazy? Because it was able to be attacked in most cases. Maintaining what's called endothelial integrity. Endothelial dysfunction contributes to vascular inflammation, that's the lining of the blood vessels, and impaired blood clotting. And those are 2 hallmarks of COVID-19. Vitamin D boosts your overall immune function by modulating your what we call innate and adaptive immune responses. It reduces respiratory distress, it improves overall lung function, and helps produce surfactants in your lungs that aid in clearing the fluid out. It kind of breaks up the fluid and helps get that mucus out. It lowers your risk of comorbidities, including obesity, type 2 diabetes, high blood pressure, heart disease. All of these factors are important in prevention of all disease, not just COVID. Now, COVID-19 emerged in winter. That's when it first started with us. And it was pretty bad. And then the summer, of course, you start to see a little drop off. But now what's happening? Winter's coming. Sounds like a TV show. Winter's coming. So what happens now is we're getting a lot less sunlight. The UVB rays from the sun are hitting the earth on an angle as winter sets in. That's what makes it colder weather. And we're getting less vitamin D. We're staying more inside. And I've done shows on immunity before, too. Dark-skinned people. There's a high rate of COVID among people with dark skin. One of the reasons maybe is that they're just not getting enough vitamin D. If you're fair-skinned, 10 to 15 minutes a day out in the sun is great. If you're very dark-skinned, you might need 1.5 hours a day out in the sun to produce the equivalent vitamin D that you need. So this is why I'm such a big advocate of vitamin D supplementation, especially in the winter months, and especially if you're dark-skinned. Now, ultimately, you should get your vitamin D levels tested. So if you're getting your blood test done, tell your doctors, I want to get my vitamin D level tested. Very seldom, in fact, I don't think ever in my entire career, have I ever seen somebody come in with normal vitamin D levels unless they're taking supplements or they're out in the sun a lot in the summer. In the winter, I hardly ever see normal vitamin D levels unless you're supplementing. So we want to get those vitamin D levels up. You want to optimize the vitamin D because it's strengthened by the fact that higher levels are not only reduce your risk of testing positive for the virus, but also cut the risk of severe illness that need hospitalization, of course, ventilation. So there's several ways that vitamin D works, and I'll go through this. Lowers your infection rates, lowers your hospitalization rates. Having vitamin D levels below 30 nanograms per milliliter about double the risk of being hospitalized with COVID-19. Now, I'll play my own devil's advocate. If somebody has low vitamin D, chances are they're not taking care of themselves anyway. So it might be other factors as well. But this is one factor that we can measure and then do a correlation. Above 30 nanograms per milliliter, it also lowers your need for intensive care if you are sick. Reduces severity of the symptoms. It reduces mortality. It works pretty well. Now, I personally like to have my own vitamin D levels not at 30 nanograms per milliliter, but about at 60 to 80 nanograms per milliliter. Now, I take supplements. I eat a really good diet. I keep my body active. I get good sleep. I get chiropractic care. And when I had my vitamin D levels tested at the beginning of seasons, I was at 58. 60, again, is where I want to be. So I was even a little low. And I supplement almost every day. And so you got to realize that even when you're doing everything right, it's a good idea to do blood work. In our office, we can test vitamin D levels. But if you're going to go see your primary care doctors, getting a blood work done, I'm begging you, please, get your vitamin D levels checked. And they may recommend vitamin D2 as a prescription. Not the way I like to do it. Again, I don't want to argue with other doctors. Everybody has their own techniques. But what I like to do is I like to give supplements over time because they may give you 50,000 international units of vitamin D once a week. Well, not my favorite way to do it. I like to do 50,000 international units over time. I do 5,000 units a day. That's how I do mine. Now, when I found out my vitamin D was a little low, I bumped it up to about 8,000 international units a day. I'm waiting a few more weeks. I'll get my vitamin D tested. You also want to make sure you're getting magnesium because magnesium is required for the conversion of vitamin D into what's called its active form. So where do we get magnesium from? You could take supplement, but this is one of the foods you really don't need to supplement. One of the supplements you don't need to supplement if you're eating a good diet. You can get it from green leafy vegetables, from nuts, some seeds, from avocados, from tofu. So if you're eating a good diet of fruits, vegetables, nuts, and seeds, chances are you don't need any more magnesium. Here's one way you can tell if you need more magnesium. Take a supplement. If you start getting gas and bloating and diarrhea, you've got too much. You've reached what's called your bowel tolerance. You can only absorb so much of anything. And if you're putting too much in, vitamin C does the same thing. It just basically comes out. So another cofactor is vitamin D is K2. We've talked about that so many times. Vitamin D helps you absorb calcium, aside from helping the immune system and what we're talking about here. Vitamin D helps you absorb calcium. Vitamin K2 directs the calcium to go into the bones and not settle into the joints or the blood vessels. So it's really important that you're doing vitamin K2 with vitamin D3. Okay? Those two work very well together. You want to make sure also you stay away from sugar because sugar will weaken your immune system. We can do studies on white blood cell activity, and you could drink 1 can of soda, and the white blood cell activity drops like multiple times. I have the exact number in the second book I wrote. I can't think of it right now. But you eat sugar, blows out your immune system. When do we eat sugar? Pretty much every day. It's in sodas, cookies, cakes, donuts, pastas, breads. So when you're eating these sugar-high foods, you're just blowing out your immune system. Now, especially if it's a holiday time, what happens? People bringing you cookies and cakes and donuts and cheesecakes and pumpkin pies and sweets and sugar cookies and gingerbread. And what I do, people bring it to me all the time. Even though people know me, I've been a vegan for 34 years now. I'm not asking you to be a vegan. You should be. I'm not asking you to, though. People bring me stuff all the time. And you know what I say when they bring it to me? Thank you. That's it. Thank you. I really appreciate you thinking of me. It's not the actual gift that they gave me. It's the fact they thought about me. And they said, I want to make sure Dr. Joe gets something nice. In their mind, it's nice. In mine, it's not. So I'll just take it and I'll dispose of it. But years ago, I learned a lesson. I had an older patient come in, and she was barely walking. I remember she was with a walker and a wheelchair, and she was in so much pain, and we gave her the chiropractic care that we administer, which is different than a lot of other doctors. Then we had the nutrition component, too. We got her digestive system working, got her on a good diet, and she walks now, and she was fine. And she came in, and she said, I made you these chocolate chip cookies, Dr. Joe, because you saved my life. And I said, that's wonderful. And I said, what's in them? First mistake. Stupid Dr. Joe. Well, there's flour and eggs and sugar and butter, and it's my old family recipe. And I said, oh, I don't eat animal products. And this poor lady's jaw hit the floor. She was heartbroken. And I learned a lesson that day that I was an idiot. I should have said thank you and taken them to the back office and then dispose of them accordingly. So you don't have to eat something because people give it to you. You just have to say thank you because they gave it to you. And that's it. It's really simple. And when you do that, you're showing gratitude. They're appreciating it. What happens to the cookies after that, you can decide. But keep the body warm as well. The immune system works very well when it's warm. Your mother talked about not wearing a hat and getting a cold. Not necessarily. There's no studies that show that. But what happens is if the body gets cold, it can weaken the immune system. And that's why keeping the body warm, like a hot shower, a hot bath, actually helps raise the body temperature and can actually stimulate white blood cell activity. And that works really well, too. You got to stay hydrated. In the winter, we dry out. We get dry skin, dry sinuses. If the sinuses are dry, you have mucus in there to protect the viruses, germs, and bacteria from being absorbed. If the sinuses are dry, it has an easy entry point. Washing your hands, absolutely. Make sure when you wash your hands, you use warm water and soap. The reason is viruses, COVID especially, that we're talking about, has what's called a lipoprotein layer. It's fat around it. And the fat has to be dissolved. And what dissolves fat really well is soap and water. And if you're going to do an alcohol clean, don't use pure alcohol. You have to have water in the alcohol as well as a sanitizer because the alcohol will dissolve the fat and then the water gets in and destroys the RNA that's in the virus. So I'm going to have to go to a break, folks. If you have any healthcare questions, send them to me through our website, drjoe.com. If you want to make an appointment to come see us, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. We would love to be your doctors. Who's a good candidate? Neck pain, back pain, shoulder pain. If you've ever been in a car accident, if the car was damaged, you were damaged. Digestive issues. We have PRP in our office for arthritis. It's actually injecting your own healing cells back into the body in a concentrated form. It works well for erectile dysfunction, hair loss, non-surgical facials we can do with the PRP. We can do hormone balancing. We can do blood work and say, listen, let's see what your hormones are. Are you producing too much testosterone, too much estrogen? What supplements can we give you? Maybe medication. What can we do to balance you out? So if you want to make an appointment, if you're sick and tired of being sick and tired, go to our website, drjoe.com. You can book it right online or you can call us. We accept most insurances, car accidents, sports injuries. My team of doctors want to help you get well and stay well. I'm Dr. Joe Esposito. We'll be right back. Hey folks, Dr. Joe Esposito here. Glad to be with us. First half of the show, we talked about cold versus flu versus COVID and signs and symptoms, and we talked about vitamin D. And the studies are out, very clear, recent studies just out like a couple of weeks ago, showing that the higher the levels of vitamin D in people, the lower the risk of getting the disease. It's not the cure-all, it's not the end-all be-all, but it's one thing that you have control over. So we live stream these shows, by the way, and if you follow us on Facebook, Instagram, and YouTube, at Dr. Joe Esposito. In fact, you better do that, by the way. This is your homework assignment. If you're listening or watching this show, you need to follow us on Facebook, Instagram, and YouTube, at Dr. Joe Esposito. It's your cover charge for the shows. It's free. Do it. It's done. You'll never hear from me again. But you need to do that because we need to become an influencer and we need your help. But somebody asked, what about a protocol? My protocol, supplement protocol, like the starter kit, if you would, for supplements, would be minimum supplements everybody should be taking is Dr. Joe's Super Greens and Dr. Joe's Essential Source. They're 2 powders. They taste great. I mix them together, coconut milk, almond milk, make it a smoothie, whip it up, drink it. I can't imagine a day without them. That's your minimum supplements I think everybody should be taking. Wintertime, I'd also add vitamin D. I do 5,000 international units of vitamin D. It's 5 drops of Dr. Joe's vitamin D. And it has vitamin K2 in it. We talked about it earlier in the show. This show, by the way, is on our website, drjoe.com. You could listen to it if you want to. You could type in today's date, probably be the best thing. But you could also put in COVID. It should be under COVID. It'll probably be listed under testosterone, which is my next topic as well. Glutathione is really important for the immune system and for liver function. And then if you can do it, I'd also add omega-3 fatty acids. So Super Greens, Essential Source, vitamin D, and glutathione is the starter kit. If you need energy, you need circulation, then I'd add nitric oxide, B-complex. Somebody sent me an email earlier today and I said, Dr. Joe, I work weird hours. I'm just exhausted all the time. What can I do? And I said, well, so for energy, glutathione, not glutathione, nitric oxide, B-complex, adrenal support, Super Greens, and Essential Source, and you'll be buzzing. So, but again, Super Greens, Essential Source, vitamin D, and glutathione is a minimum, and then omega-3 fatty acids if you want to go a little further. So, all right, let's talk about testosterone because I think we beat the COVID topic down enough here. Testosterone is the most notorious of all hormones, I think. It conjures up thoughts of muscle heads and these guys working out with ripped muscles everywhere. But testosterone does fuel sex drive and muscle mass, but it also regulates mood. It regulates bone strength. And when men's level falls below normal, there are several things you might want to consider doing, and that's what we're going to talk about today. Slow drop in testosterone, normal part of aging. It's going to happen. I was just talking to a medical director who works in our office before this, and he said your secretory glands, the glands that produce and secrete things like hormones, your pituitary gland, your adrenal glands, your testicles, your ovaries, they're going to get weaker as you get older. It's part of the aging process. So men go through something called andropause, or male menopause, and for men, it doesn't cause any significant problems or symptoms. You may notice a decline in muscle mass, depression, less interest in sex. That happens as the testosterone starts to drop. The good news is I'm going to tell you some things we can do to boost the testosterone naturally. And for women, too, we need testosterone. Low testosterone can cause visible damage in men. It could cause shrinkage of the testicles, larger breasts, thinner muscles, loss of body hair, especially off the chest, the legs. So this could be signs of lower testosterone. And in fact, it was funny, in the summer, I was visiting my mom and I had shorts on. And she said, "You still got hairy legs." And I said, "Am I not supposed to?" And she says, "Well, your father and his brothers, they started losing the hair in their legs even in their 40s. And so it's just a sign of testosterone starting to drop. Low testosterone can affect your bones. You think of osteoporosis or brittle bone disease as a woman's disease, but it happens in men too. And in our office, we do a lot of pain management, of course, chiropractic, nutrition. I'm board certified in orthopedics, pain management, chiropractic, and double board certified in nutrition. So we see a lot of patients with a lot of different conditions. And we'll take x-rays on a lot of our patients, and many times we can actually see the beginnings of the osteoporosis. A bone has to lose about 33 to 39% of its calcium before it even shows up on an x-ray. So you can scan it with other things, but if you start to see thinning bone on an x-ray, you got a lot of bone loss going on. And that could be due to testosterone levels dropping off. Low testosterone doesn't always interfere, it depends how low it gets, with a man's sex drive, but it can make it more difficult for the brain and the body to kind of communicate and actually start to respond. And that becomes an issue. That's a sign of testosterone, low testosterone. Some men may notice a drop in libido. Others may lose interest in sex completely. Low testosterone can also make it tougher for a man to function sexually. And so if you listen to any radio station, there seems to be commercials constantly about, oh, we've got this wave and this thing and this treatment. And all of that does help. I mean, all of them work. My concern, though, is when they talk about response on the first visit. Usually they're going to inject you with something. And you can inject PRP into the man's sex organs, and that can start to regenerate natural healing. You can use lasers. You can use soft wave therapy. That what it does basically is it traumatizes the organ, and it can cause a little damage to the muscles and the blood vessels, and then the body sends in healing tissue to grow new new muscle. It's just like working out. If I'm going to lift a weight, I'm going to tear up and damage the muscle, and then it's going to regenerate. I lift it again, it's going to tear up and regenerate. Same thing works with sex organs for men. You can it doesn't hurt, but slight damage to the body, and then it sends in new vascularity and neurogenesis. It actually can grow new nerves and new blood vessels. So when you add something like PRP to that, PRP is your own cells. We take the cells out of your body, blood, spin it down, and take out the platelets. We can re-inject it into joints. If you have arthritis, it can stimulate new growth. It's not going to make it like it's 16 again, but it works wonders. If you're in early stages of arthritis, it works wonders in most cases. For sexual regeneration, works wonders in most cases. And then you could add other things to it as well to see some changes. And in most cases, it works great. We also want to make sure the testosterone is getting up there. So what we do in our office, if a man is having issues, or a woman, we'll take a blood sample of them and see. So let's assume I take your blood levels and your testosterone levels are low. Well, we might recommend supplements. We might recommend nitric oxide, adrenal support. Sometimes I'll recommend fenugreek, which will raise testosterone levels. You want to get people on boron. Boron helps free up the testosterone and make it usable. It's called free testosterone. Many times we may even recommend short-term bioidentical hormones, where you can actually inject yourself with testosterone, very low levels, and amazing how quickly it works. I did it with myself. My testosterone was normal. So I said, let me try it. So I did some bioidentical hormones. I did 5 shots of the lowest dose, almost the lowest dose available, and my testosterone got too high. I had to actually stop doing it. So those are some things that you might want to consider for testosterone and things you can do to increase the levels. But nitric oxide, adrenal support is there. I'm working on a supplement now, folks, with my chemists that's going to have things like taurine, which will give you energy. We'll get some boron in there. We'll get some fenugreek, and a supplement that will actually be not only stimulate or increase the sex drive, but actually increase the testosterone level. So I'm working on that. I'm formulating it in my head, and I've experimented, and it seems to be working pretty well. Testosterone can affect mood. Some men have subtle problems with mood changes, poor concentration, less energies. These symptoms can easily be caused by other health problems like anemia, depression, sleep problems, chronic illness, pinched nerves, pain. We've done several shows, I think, on depression. And if you go to our website, drjoe.com, we have over 1,500 hours of podcasts, audio and video. So type in what you're looking for. Chances are we've done an audio, video, or an article on it. And if you still have questions, you can always send a question through the website, drjoe.com. I'm more than happy to answer your questions for you. And all the supplements we talk about, by the way, too, are on the website, drjoe.com. The fenugreek and boron is not yet. I'm still formulating that. But all the other ones are on the website, and we'll ship it to you. Or you can come by our offices. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. We would love to be your doctors. We can do neck pain, back pain, shoulder pain. We're a team of chiropractors and medical doctors, and we're really good at pain management. In fact, patients come from all over the world to come see us. I get referrals from doctors. I had a patient yesterday, and his therapist sent him, young kid, teenager, very depressed. But the digestive system is directly related to your anxiety and your depression and your mood levels. Because if you're not breaking down your food properly, you're not able to absorb the nutrients, and that can affect how the brain functions. And so the therapist will send patients in and say, listen, maybe not necessarily your classic chiropractic case, but what can we do to get his digestive system working? He had acid reflux, terrible, which tells me his stomach was pushed up against the diaphragm. So we adjusted, we pulled his stomach down away from the diaphragm. We're going to put together a nutrition protocol for him and supplements. And in most cases, when it comes to emotional issues, we resolve the issue. It's really kind of cool. So again, we get referrals from all over the world and from doctors, hospitals, insurance companies, military. We get them everywhere because we try to get to the cause of the problem and not just treat the symptoms. And that's the key. And all my doctors are handpicked by me. They're trained by me, and they're my personal doctors. So if I don't trust my doctors taking care of me, I don't trust them taking care of you. Okay, so feel safe in knowing that you're in good, in my opinion, you're in some of the best hands in the world. So if it's a chiropractic, is it medical, is it a hormone issue, is it a PRP issue? We're going to put together a protocol specifically for you. So what causes low testosterone? Type 2 diabetes can do it. Liver issues, obesity. If you're fat, and I used to be fat, so I can say the F word. If you're fat, fat produces estrogen. Estrogen causes you to lay down fat, which produces estrogen, which causes you to lay down fat. So you're kind of caught in this cycle. And so I used to be fat. I understand it. But if you're obese, the estrogen blocks up the receptor sites where testosterone is absorbed. So testosterone is going to be absorbed and then activate the cells. Estrogen will just block up and you won't be able to absorb the testosterone. And so even if your testosterone levels are normal, if your estrogen levels are also high, that can be causing problems. So I know it gets a little complicated when it comes to hormone therapy, but we want to do everything we can to balance it out. Good diet, that's a no-brainer. No animal proteins, because a lot of them have estrogens in them. Even if they're organic, they still have estrogens in them. So I would say stay away from animal proteins, eat more fruits and vegetables, things that are high in nitrates, like beets, arugula, greens, will convert into nitric oxide, which will open up your blood vessels. Make sure you're feeding your adrenal glands, not giving them stressors like coffees and teas and chocolates and cigarettes and drugs. Pituitary gland problems can cause testosterone issues. Injury to the testicles. I used to play hockey and football, and I remember one time getting hit with a slap shot, and I was not prepared. And let me tell you, it hurts. Okay, but things like that could actually affect function later on in life too. Tumors can do it. Radiation therapy, chemotherapy, steroids can do it. So there's a lot of things that are attacking testosterone on a daily basis. The good news is we can test for it. Is it testosterone? Is your testosterone not converting into free testosterone? Is the testosterone converting into estradiol, which is an estrogen, which blocks up the testosterone receptor sites? And we try to do everything we can to boost up that testosterone level. And in most cases, it works great. It may take some time, though. Don't think you're going to come in and walk out going, hey, I'm 16 again. It's going to take a little time. But we want to get that testosterone not just for sex drive and muscles. Your heart's a muscle. Your colon's a muscle. Your blood vessels are muscles. It helps bone strength. It helps mood swings. It's so important that you get that testosterone level normalized, and we do everything we can to help you get there. If you have erectile dysfunction, low sex drive, low sperm count, loss of height, loss of body hair, loss of muscle size, right away I start thinking, let's do a testosterone test and see where we are. If you have an illness known to lower testosterone, we also want to know about that. So when you come to us, and this is important too, if you come in as a patient, tell us what's going on. Because if we don't know what's going on, we don't know what to do about it. So patients say, oh, I forgot to tell you I had back surgery. Oh, I forgot to tell you I got hit by a car when I was 10 years old. Oh, I forgot to tell you. Don't forget to tell us. Tell us so that we know better how to better put together a protocol for you. Because even if it's a neck pain or back pain, it's a chiropractic case, we need to know that you might have had surgery. We need to know that you have a condition like Ehlers-Danlos syndrome where the ligaments are weak. We need to know, of course we would probably know this, if you have Down syndrome. Because with Down syndromes, the alar ligament many times in the neck is weak, and there's different ways we adjust people with Down syndrome because there may be weakness of the ligaments. There may not be. So again, more information we have, the better we are. You don't have to tell us that at age 6 you scratched your knee. That's okay. That's normal. So, but we can do it, and again, we're talking in this segment of the show on testosterone. Testosterone measured with a blood test done early in the morning is best when the levels are the highest. Normal levels range from 300 to 1,000. But again, it's not just the testosterone. We want to measure your free testosterone. We want to measure your estradiol. Is the estradiol too high? And that's blocking the receptor sites. So it's a lot more than, hey, I got my testosterone tested and I'm good. In fact, several years ago, somebody came to me and they were starting a company. They were going to give testosterone shots. And they wanted me to endorse them on the radio. So I went to their clinic and they drew my blood. And they said, oh, you got low testosterone. You would be a classic candidate for this. And so I took my information. I went home. I did research like I do every day. And I realized they were comparing me to somebody 25 years younger than me. And I said, well, my testosterone is going to be lower just high because I'm older. And I went back to them. I said, well, you're using a standard here that doesn't make sense. And they said, well, that's the standard that we use. But it doesn't make sense. So when I compared myself to where I should be, I was a high end of normal. And I said, so that's kind of deceptive advertising. If I'm, Joe Public, I look at it and I go, oh, okay, well, I guess I'm low. I guess I need testosterone. It wasn't true. So anyway, they went out of business, and that's just another story. But once again, you got to look, when you look at blood tests, you got to understand a lot of parameters. When we look at pain management, we have, of course, every day patients come in our offices, neck pain, back pain, shoulder pain, headaches, numbness, tingling, leg weakness, swollen feet, acid reflux. We look at it, and I remember when I was studying to be an orthopedist, my teacher, Rick Ackerman, he says, if you don't know it exists, you can't diagnose it. And he was great because he'd put up test questions. We'd put up x-rays and say, what's wrong with this? And we'd see a fracture in the bone. We'd say, it's a fracture right there, Dr. Rick. There's the problem right there. He said, you're absolutely wrong. The fracture is stable and did not cause the pain. Look down here, and there's like a little tumor or a little blood clot. And he said, that's the thing that's causing the problem. So you can't just go for the obvious. You got to dig a little deeper, and that's what we do in our offices. So if you have an issue, if you have neck pain or back pain, or you want to get your blood work done, or you want to talk about PRP for arthritis or hair growth or non-surgical facials or erectile dysfunction, women, leaky bladder. How many women have leaky bladder? Raise your hands. A ton of you do. And I know this because you don't talk about it in social circles, but you talk about it when you come in our office. We can actually do PRP for leaky bladder as well. And women that have low sex drive or can't enjoy sex, we can actually do that as well. And so, again, no guarantees or promises, but these are alternative therapies that people don't even know exist. And that's what I want to let you know, that these alternative therapies are there for you, and you're safe when you come to us. We don't talk about your cases to anyone. Don't worry about it. So if you do want to make an appointment, you can do it right online, drjoe.com, drjoe.com. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. The initial chiropractic visit was normally $375. Exam, x-rays, consultation, first adjustment, and then the second visit going over your x-rays and the nutritional evaluation. Normally $375. We've reduced that to $199. We do accept insurance for treatment after that. So we're more than happy to file your insurance for you. Medicare we take. And there's a new thing out, which I'm very excited to talk about, that if you're at the VA, if a VA doctor refers you to our clinic, the VA insurance, which is called Optum now, should cover you. Okay, so you got to get a referral from your VA doctor to us, and in most cases, the insurance will start to cover that now. And I just found out about that yesterday, as a matter of fact. So that's big news. So if you are a VA patient, you can always talk to your VA doctor, see if they think we would benefit. We are in network, is what I'm telling you. So if you want to make an appointment, drjoe.com. You can do it right online. We have offices again, Marietta, Duluth, Stockbridge, and West Cobb. We even have Saturday hours in our Marietta office. So we want to be your doctors. We want to help get you well and keep you well. Nutrition, chiropractic, pain, we're there for you. So we're talking about testosterone. We talked about testosterone converting into estrogen, then estrogen blocking up the testosterone receptor sites. There's an enzyme in your body called aromatase. And aromatase converts testosterone into estrogen. I don't want to get too heavy into this because I don't want to confuse you there. There are medicines we can give you, and they give this a lot of times with women if they have cancer that's sensitive to estrogen. They want to lower the estrogen levels. And so they'll give them aromatase inhibitors. Grapeseed extract is also a good aromatase inhibitor. And diindole methane. Diindole methane is a component that's found in cruciferous vegetables, things like broccoli, Brussels sprouts, cabbages. Diindole methane acts as an aromatase inhibitor, preventing testosterone from converting into estrogen. I know it's a lot of blah, blah, blah. We have a supplement on our website, drjoe.com, called Estrogen Regulator, and it's diindole methane. And so in cases like this, we may put somebody on an estrogen regulator. I do not recommend you take diindole methane or any estrogen blockers or aromatase inhibitors if you're perimenopausal or postmenopausal. You want to talk to your endocrinologist or doctor about that because we don't want to lower your estrogen too low. That's one of the issues. So anyway, diindole methane, that's why Brussels sprouts and cabbages and the cruciferous vegetables are really good. Why are they called cruciferous? Absolute useless information. When the flower forms on the plant, it's in the shape of a crucifix. And that's why they're called cruciferous. Useless information. I thought I'd throw it out there for you. So, risk of testosterone therapies. You may make too many red blood cells. Sleep apnea. You can't sleep. It can enlarge your prostate. That's an issue. If you have prostate cancer, you might want to be careful about that. And in some cases, it can actually increase your acne risks, which is pretty rare, but it can happen too. The risks and benefits of taking it for many years, still not sure. But what we do in our office with testosterone, like I said, we can measure it. We may recommend hormone replacement therapy. We may recommend supplements. We may recommend aromatase inhibitors, depending on what the cause is and why the estrogen and testosterone are imbalanced. If you're overweight, we got to get you to lose weight because that's producing estrogen. And I can give you all the chemicals and drugs and supplements in the world, but we got to work on that. We have a real good show on our website, drjoe.com, and it's on weight loss. And so if you want to tune into that, we go into in-depth how the brain works when it comes to why we're overweight. It's really a brain issue. It's not it's not a stomach issue. It's a brain issue. And we talk about how things that get us fat can stimulate the nucleus accumbens in your brain, and nucleus accumbens releases dopamine, and dopamine gets you high. You're getting high from it is all it is, and you're an addict. So we talk very openly about that. We have in our office, we have a plan. It's called the 21-Day Weight Loss Protocol. It's on the website, drjoe.com. And what it does, it's supplements, and you eat a lot of fruits and vegetables. And my goal with this protocol is for 21 days to reset your brain. I want your brain to stop craving these junk foods. And if we can do that, then in most cases, we get some real good results. So that may be something you might want to consider as well as a jumpstart protocol to get things working. And again, we got to be careful. Men who shouldn't take testosterone, if you have prostate or breast cancer, if you have poorly controlled heart disease, untreated sleep apnea, too many red blood cells, clotting disorders, all of these can be problems that a lot of people have. And so that's why we try to find out. You got to tell us what you have so we can go ahead and deal with that. But supplement-wise, I can't imagine anyone not taking supplements every day. Supplements to me are just part of my dietary plan. I wake up, I take Super Greens and Essential Source, some coconut milk, I have a little jar, I shake it up and I drink it. Always start my day with that. Then in the winter, of course, I'm always going to take the vitamin D. I take omega-3 fatty acids for brain function. I take nitric oxide for circulation. I take B-complex. If I eat a cooked meal, I always take digestive enzymes. Digestive enzymes help break down your food. As you get older, your enzyme levels drop. Again, things don't work like they used to as you get older, but we can fight that. We have the whole protocol is called anti-aging. So chiropractic is great because it puts the bones back in place, opens up the nerve supply, takes the stress off the discs so they don't wear out as quickly as they usually do. Then we do nutritional protocol, and we do the supplements, the Super Greens, the Essential Source, the nitric oxide. Maybe we need estrogen regulator. We also have something called DHEA. It's men's hormone and women's hormone supplements. DHEA converts into testosterone. So if you're under stress, we talked about this the other day, if you're under stress, your body produces a lot of cortisol, okay? Your body produces pregnenolone. If you're under stress, that pregnenolone becomes cortisol. If you're not under stress, that pregnenolone becomes DHEA, and the DHEA becomes sex hormones. Testosterone is one of them. So if you're under stress, you're never getting to that point where the pregnenolone becomes DHEA, and it just keeps converting over into cortisol. So we can give you a DHEA supplement, which kind of overrides that, kind of sneaks in underneath the cortisol, and then that helps raise the testosterone levels and hormone levels as well. Balance them. I shouldn't say raise, but balance them. So there's a lot of things we can do with supplements that are really cool that work the way your body would work. Now, if you need medication, absolutely. If you're in severe pain, our doctor may give you an injection. He may ablate or burn a nerve to cover up that pain. So there's a lot of different protocols we can utilize with you. So if you're serious about wanting to get well, if you'd like to make an appointment, go to our website, drjoe.com. You can book it right online. We have offices in Marietta, Duluth, Stockbridge, or West Cobb. You can call us if you'd rather talk to somebody to book it. We accept most insurances, car accidents, sports injuries. If you're ever in a car accident, if the car was damaged, you were damaged 100% of the time. So you do want to consider your health. And people come to us, and usually, many times, they're our last resort, and they say, Dr. Joe, I'll do whatever you say. And I'll say, well, what I say is you got to get the diet right, you got to get the nervous system right, and you got to get your digestive system right. And when we're able to do that, the body is able to get healthy. So that's our goal. So if you want to make an appointment, please do. We do accept Medicare. We do all the billing for you. Car accidents, again, come see us as quickly as possible. What the insurance companies are doing now is you're in a car accident. If it's more than 2 weeks out that you started seeking treatment, they're probably going to deny your claim. They're going to say you weren't hurt. Even though you were hurt, they're going to lie about it. So if you want to come see us, the initial visit is normally $375. We've reduced that to $199. If you want to set up an appointment with our medical doctor, make sure you tell the staff when you do that to set that up. But we want to be your doctors. We want to get you well and keep you well. Again, the website, if you have any questions, send them to me through the website, drjoe.com. I'm Dr. Joe Esposito. Thanks for tuning in. We'll catch you next time.